ISTEP, Innovative Strategies to Transform the Education of Physicians, is a consortium of medical schools convened by the AMA around research in medical education, really with an interest in professionalism activities, although not exclusively focusing on that. The ISTEP consortium now numbers about 40 U.S. and Canadian medical schools who have participated in some form. Its mission is to improve the care of patients through advances in medical education research. The initial group was composed of 16 schools or consortia, so there were a total of 27 schools. We really wanted to look at the impact of the learning environment as perceived by students on selected outcomes. These are things like empathy and coping, professionalism, and patient orientation, patient-centeredness of our students. And to look at institutional variables that are that might be related to that. So we're also looking at public versus private schools, the size of the medical schools, some factors of the curricular model. And some people have pointed out, Pat Carney and others in the last decade, that one of the problems with medical education research has been that it tends to be at a single institution. So we look at what we're doing in our own institution and maybe have an intervention. But to really get an idea of the impact of different forms of education, it would be very helpful to have a number of different medical schools with different characteristics. The first cohort in 2010, 12 of schools participated, and people heard about it, wanted to join in, and 29 schools are in the 2011 cohort that just started. In terms of numbers, 1,850 students in the 2010 cohort, about 6,000 in the 2011 cohort. Since there is a research element to this, there are IRB protocols. The University of Michigan submitted the protocol to their IRB and had an overall approval. Then each school did that, submitted individually to their own IRB.
You know, it's interesting to think about how do you measure the learning environment. There are so many ways to go about it. And there are so many ways that we aren't anywhere adequate for what we really want to know about the learning environment. This is our battery of measures. The first one, the medical student perceptions of the learning environment, has been out in the literature for about 20 years. We're using a shortened version, and I'll say a little bit more about that. But 17 items. Patient practitioner orientation scale, which is thought to be a measure of patient-centeredness. I'm willing to work collaboratively with patients. The Jefferson scale for empathy, this has really become a bit renowned, and we're very grateful to Dr. Hojat for allowing us to use the scale as part of this, but this is the empathy scale that people like to quote, that between first year and fourth year, students seem to be losing empathy. This is the measure that has been used for that. Ways of coping in terms of, again, traits that the students themselves bring and carry through medical school, tolerance of ambiguity. At the same time, we've collected some demographic information on the students, and of course we have all of the local data at the school level, including the curriculum, size of class, and other things. Outcome of interest, and that won't be our only outcome, but I guess you might call this our independent variable, the medical student's perception of the learning environment. As I said, this is an abbreviated scale, 17 items. The literature comes from Rosenbaum, Academic Medicine, 2007, and those of you that are interested in the other instruments, we can share some of that with you after the session. There are 7 subscales, and the subscales are ones, as you think about the learning environment, I hope make intrinsic sense to you. Breadth of interest means the student reports that they're encouraged to keep a balance in their life outside of medical school, to keep that breadth of interest. Supportiveness in these questions means the student says the faculty and staff are supportive, want me to learn, encourage me. The organization is about the curriculum, and again, the questions are such that they have to do with the curriculum is integrated in a way that makes sense and allows me to build on learning that I've had. So just to give you a better picture of some of the measures that we can look at for our outcomes. We aren't only interested in the learning environment, we really would like to understand the dimensions of professionalism and what is promoting professional attributes and what might be detrimental. And so we had a rich discussion with a couple of colleagues that were invited to talk to us about how do you measure, how do you think about professionalism. Professionalism has to be based on core things like clinical competence and knowledge, communication skills, and ethics and legal understanding. But that's the base, that's not enough. And they describe other elements that need to be present: excellence, humanism, accountability, altruism, and these are the pillars above the base on which professionalism rests. So it's a lovely, rich way to think about it, because when we talked about how would we measure professionalism, we had to consider so many dimensions. And we don't have the answer yet, so if you all want to talk to us about it, we'll very much welcome that. For example, do we really want students to describe their self-perceived professionalism? I think most of us would prefer direct observation in some way. People can put on a great act in their OSCEs and other places when they're being observed and look like professionals at a superficial level, but then when you go behind and ask the folks on the team, as we're now doing as we do team care evaluation, obviously the dimensions of professionalism have to be deep and held intrinsically. And the other dilemmas that I have here about how much can we do now that could be qualitative to add to the quantitative. And clearly you can see that now we have an opportunity for either sub-studies or even interventional studies, which ultimately is the interest of this group. Okay, now that we know what we know, how do we improve the learning environment? And that's the most, I think, interesting part to all of us.